about. Let's start with children. Autism is the most severe disorder. We have an epidemic of autism. 25 years ago, we were diagnosing one child in 10,000. 15 years ago, we started diagnosing one child in 150. Today, we are diagnosing one child in 35. And by 2025, in the English-speaking countries, it is predicted we'll be diagnosing one child in 2. Half. And it's not going to stop there. This avalanche is coming upon humanity very rapidly. Who is going to look after these children? The other half? The other half is going to have an epidemic of diabetes type 1, of leukemia, of rheumatoid arthritis, of schizophrenia, obsessive-compulsive disorder, bipolar disorder, and other disorders. Who is going to look after them? What happens to an autistic child? Almost 100% of autistic children in our modern world are born with a perfectly normal brain. These are perfectly normal children. But they acquire abnormal gut flora from day one, from their mother at the moment of birth, these children. So their digestive system, instead of being a source of nourishment, becomes a major source of toxicity in the body. A river of toxins floods the bodies of these children in the first and second years of life. These toxins get into the brain and clog it up. How do babies learn? If you observe a baby, they listen to everything, they look at everything, they have this shameless baby stare. They stare at you for a long time, they're figuring you out. Who you are, why you're here, are you safe? They touch everything, they take everything in their mouth. What are they doing? They're using their sensory organs to collect information from the environment. Their hearing, their vision, their tactile sensitivity, their taste buds. They're collecting information. And then this information is passed to the brain to be processed. And from this information, the child then learns that this is mommy and this is daddy. I can trust them. This is food, I eat it. These are toys, I play with these toys like this. These are other children in the family, I copy them. But the brain of the child is clogged with toxicity. All this sensory information coming to the brain is not processed appropriately. It turns into a mush, into a noise in the child's brain, and from this noise the child cannot decipher anything useful. That is why autistic children do not learn that this is mommy and daddy. They are known to pick up a hand of any stranger on the street and walk away, with mommy running behind and screaming his name. Because mommy doesn't mean any more than any other human being around. They don't know what to do with toys, they don't know what to do with food, they don't know what to do with other children. And instead, the brain develops screen-saving procedures which manifest themselves as self-stimulation, or stims. These are repetitive, senseless movements that the child is engaged all day long. Jigging on their tiptoes, back and forth, or sitting down, getting up, or vocalizing repetitively, or doing something else repetitive. This is a screen-saving procedure for the brain, just like your computer has a screen-saving procedure. The longer the child is trapped in this toxic fog, in this toxic state, the more physical damage is inflicted upon their brain, because these children were born with a perfectly normal, healthy brain. When we do PET scans with 3-year-old autistic children, we find a perfectly normal brain. When we do the same scan with 23-year-old autistic individuals, we see a brain damaged by that bombardment of toxicity year after year. This physical damage, this atrophy going on in the brain, certain areas of the brain get physically damaged. So the younger these children are, when we catch them and we treat them, the quicker they recover and the more fully they recover. Autism is curable, 100% curable. All you have to do is change the gut flora, normalize it, heal and seal the gut wall, so that river of toxicity stops, and the brain cleans itself up quite quickly. And from that moment on, the child can learn all the vital skills to become a normal, fully functional human being. So the younger the child is, the less development they have missed out, the less they fell behind their peers of the same age, the quicker they catch up. The older the child is, the more damage is inflicted upon the brain, and the more they missed out on their development. It is more difficult for them to catch up with children of the same age. In my practice, up to the age of 5, 4.5, if we catch a child, we can't bring them to normality. The child can be pulled out of autism entirely. All the children will recover to a degree, but they will remain autistic because it is a bit too late at that age. Though individually, all sorts of things happen. If the mixture of toxicity coming out of the digestive system of the child is different and constitution of the child is different, the child may not become autistic, but may develop other disorders, such as attention deficit hyperactivity disorder, these are hyperactive children, or attention deficit without hyperactivity, or dyslexia, or dyspraxia. But about 80% of these children develop a mixture of individual symptoms which do not fit into any diagnostic box. They have a bit of autism and a bit of ADHD and a bit of dyslexia and a bit of this, that, and the other. So with these children, pediatricians procrastinate. They ask the parents to bring the child for observation 6 months later, and then again 6 months later. Before the diagnosis is given, precious time is being wasted when the child could have been helped. Because the younger the child is, the quicker we can pull them out and help them. So I tell the parents, do not wait for a diagnostic label. Do not wait for your doctor. You know something's wrong with your child. Parents know. They don't need a diagnostic label. They know something's wrong. Start treating the child. Start healing their gut. Start changing their gut flora. And chances are, in a few weeks' time, you will not need a diagnostic label because the child will clean up and start learning and start developing. When the amount of toxicity building in the brain is too high and the brain perceives it as being physically damaging to its own structure, in a proportion of these children, the brain develops a survival procedure, a safety valve. It sends one electric discharge through and clears the whole lot of toxins out. And that's an epileptic seizure. It is a cleansing procedure for the brain. It is a survival procedure. The last thing these children need is another toxin added to the equation in the form of discharge anti-epileptic medication. We need to be subtracting toxins. So I hope that in the future there will be time when the mainstream medicine will be putting these children on the diet first and foremost and not on medication. There is a small proportion of these children who have a very dangerous form of epilepsy where they have 10, 15 gram miles a day, and that can kill a child. So they have to be put on a suppressive medication. But majority of children are not in that category. They had one seizure and then they have none for many months. And yet they are put on medication, which suppresses brain activity. It stops the child from learning. Their ability to learn is reduced dramatically by these medications. And they just turn into couch potatoes, these children, and their personality changes. So they develop learning disabilities as a result of the medication given to them for the rest of their life, pretty much. When these children grow up, unless GAPS nutritional protocol has been implemented, the child has been treated appropriately, they become adults with GAPS. They become GAPS adults. And the first thing that happens to teenagers in this group is substance abuse. There are two reasons for this. One is physical, another one is psychological. Psychologically, these are the children who went through their childhood with mild symptoms. A bit dyslexic, a bit clumsy, not quite good at learning, not quite good with social skills. So they're usually bullied, and they find it difficult to make friends, and other children do not include them in their groups and in their games. So their self-worth gets quite a battering through their childhood. So by the time they come to teenage years, they would do anything to attract attention, to be wanted, to be invited, to have girlfriends and boyfriends. And their devil behavior and substance abuse is one of the venues that they often take to make themselves a little bit popular. That's the psychological reason. The physical reason. I believe that we humans are born to be happy. How do we achieve a state of bliss, a state of joy of life, complete happiness, being on top of the world? by the brain receiving a fountain of neurotransmitters. These are chemicals such as serotonin, dopamine, norepinephrine, endorphins, and other chemicals, and GABA, which are largely manufactured in the digestive system. And then they are transported to the brain to be used. The more we're researching these neurotransmitters, the more we're realizing that they are produced in the digestive system. These children have a digestive disorder. They do not produce enough of these neurotransmitters. So they went through their life until these years, never experiencing that joy of life, never being on top of the world, never feeling what life is all about. They are depressed to a degree, these children. Using morphine, heroin, cannabis, reckless, dangerous behaviors, sniffing glue, and other addictive type behaviors can produce that fountain for a few minutes. And the first time the child gets that fountain of neurotransmitters, they are on top of the world, and they realize that that's what life is about. And who can blame them? And that's where the physical dependency comes in. So drug addicts and people with addictive personalities are GAPS people. Despite the fact that they may not have diarrhea or constipation or pain in their digestive system or reflux or any other digestive symptoms. When we test their gut flora, it's very abnormal. And when we put them on the GAPS nutritional protocol, which normalizes the gut flora and heals the gut, their addictive behavior disappears. So that is where the treatment has to begin. Depression, endogenous depression. Again, not enough serotonin, not enough dopamine, not enough GABA. And all the medication is designed to increase the level of these neurotransmitters in the brain. These people have a digestive disorder, regardless of whether they have symptoms or not in that area. Once they start focusing on their digestive system and healing it, the depression disappears, because their digestive system starts producing normal amounts of neurotransmitters. Depending on what kind of toxins reaching the brain, the person may develop an eating disorder, anorexia nervosa or bulimia, or obsessive-compulsive disorder, or manic-depressive disorder, or the king of all psychiatric conditions, schizophrenia. Schizophrenia is one waste paper basket where psychiatrists put all the patients who don't fit into any other diagnostic box. That is why all schizophrenic patients are different. And, and they are physically very ill people. All these psychiatric patients, when you start asking questions, they have allergies, and their joints are hurting, and their muscles are hurting, and their digestive system hurts. And they have psoriasis, and they have eczema, and they have athlete's foot, and they have chronic cystitis, and they have migraines, all sorts of things. This river of toxicity coming out of the digestive system does not just affect the brain, it affects the whole body. Because the human body functions as one entity, as a whole body. All cells, all organs, all tissues talk to each other. So this is one condition. That's